Right now, somewhere in the world, a person over the age of 60 is feeling a strange discomfort in their stomach, maybe a bit of fatigue, maybe some unexplained weight loss, and they assume it's just aging, indigestion or something minor. But what many people don't realize is that pancreatic cancer is one of the most silent and aggressive cancers in the human body, and by the time it is discovered, it is often already advanced. What makes it even more dangerous is that the early warning signs are subtle, easy to ignore, and frequently mistaken for normal digestive issues. If you are over 60, or if you care about someone who is, the next few minutes could help you recognize symptoms that many people miss until it's too late. Today we're going to talk about 8 warning signs of pancreatic cancer that seniors should never ignore, because understanding these signals early could truly save a life. The pancreas is a small organ located deep inside the abdomen, behind the stomach. It plays a crucial role in digestion and blood sugar control, producing enzymes that help break down food and hormones like insulin that regulate glucose levels. Because it sits so deep inside the body, problems with the pancreas often go unnoticed for a long time. Pancreatic cancer rarely causes obvious symptoms in its earlier stages, which is one of the reasons it is considered one of the most dangerous forms of cancer. Many patients first notice symptoms only when the disease has already progressed. However, the body does send warning signals, and learning to recognize them is extremely important, especially for older adults. One of the earliest and most overlooked symptoms is persistent abdominal pain that seems to come from deep within the stomach or upper abdomen. This pain often begins as a dull ache and may gradually become more constant over time. Many people assume it is simply indigestion, acid reflux, or stomach upset. But pancreatic tumors can press on nearby nerves and organs, creating discomfort that feels different from typical digestive pain. In many cases, this pain radiates to the back, especially between the shoulder blades. Seniors sometimes describe it as a deep nagging pain that gets worse after eating or when lying down. Because it develops slowly, people often adapt to it and delay seeking medical attention. Closely related to this symptom is back pain that seems to have no clear cause. Of course, back pain is common in older adults due to arthritis or muscle strain, but pancreatic cancer can also create pressure on nerves around the spine. This type of back pain usually feels deep and persistent rather than sharp or movement related. Some individuals notice it becomes worse at night or when lying flat. When abdominal discomfort and unexplained back pain appear together, it can be an important signal that something more serious may be happening internally. Another major warning sign is unexplained weight loss. Many seniors struggle to maintain their weight as they age, but sudden or significant weight loss without trying should always be taken seriously. Pancreatic cancer can interfere with digestion and the body's ability to absorb nutrients properly. When the pancreas cannot produce enough digestive enzymes, food is not broken down effectively, which leads to poor nutrient absorption. As a result, even if a person is eating normally, the body begins to lose weight. In some cases, people may lose 10, 15 or even 20 pounds within a short period without understanding why. Along with weight loss often comes a loss of appetite. A person who once enjoyed regular meals may suddenly feel full very quickly or have little desire to eat. Sometimes this happens because the tumor affects nearby organs that control digestion and appetite signals. Other times it may be due to inflammation and metabolic changes caused by cancer itself. Seniors might simply assume their appetite is decreasing because of aging, but a sudden and persistent loss of appetite should never be ignored. Another subtle but important symptom is unusual changes in digestion and bowel movements. When pancreatic cancer blocks the normal flow of digestive enzymes into the intestines, food, especially fats, cannot be properly digested. This can lead to stools that appear pale, greasy, oily, or that float in the toilet. Some people also notice a particularly strong or unpleasant odor. These changes may seem embarrassing to talk about, but they provide valuable clues about what is happening inside the digestive system. Persistent diarrhea, or fatty stools, can be an important signal that the pancreas is not functioning normally. One of the most recognizable signs of pancreatic cancer is jaundice, which is the yellowing of the skin and the whites of the eyes. This occurs when a tumor blocks the bile duct, preventing bile from draining properly from the liver. When bile builds up in the bloodstream, it causes the skin and eyes to take on a yellow tint. Many people also notice dark urine, pale stools, and intense itching of the skin. Jaundice can appear suddenly and is often one of the symptoms that finally prompts people to seek medical attention. Although jaundice can occur with other conditions such as liver disease or gallstones, it should always be evaluated by a healthcare professional. Another symptom that surprises many people is the sudden onset of diabetes, especially in someone who has never had blood sugar issues before. The pancreas plays a central role in insulin production, and when cancer interferes with this process, blood sugar levels can rise. Some individuals are diagnosed with type 2 diabetes only months before pancreatic cancer is discovered. For seniors, especially those who maintain a healthy lifestyle and suddenly develop diabetes without obvious risk factors, doctors may consider further evaluation of the pancreas. Fatigue is another symptom that is frequently overlooked. Many older adults assume feeling tired is simply part of getting older. However, cancer-related fatigue is different from ordinary tiredness. It often feels overwhelming and does not improve with rest. People may feel weak, drained, or unable to perform normal daily activities. This type of fatigue occurs because cancer places significant stress on the body, affecting metabolism, hormone balance, and immune function. Another symptom that many people do not associate with pancreatic cancer is nausea and vomiting. As tumors grow, they can press on the stomach or the first part of the small intestine, partially blocking food from moving through the digestive tract. This can lead to a feeling of fullness, nausea after eating, or even vomiting in more advanced cases. People sometimes mistake this for gastritis or a stomach infection, but when it persists for weeks, it should not be ignored. It is also important to talk about risk factors that increase the likelihood of pancreatic cancer. Age is one of the most significant. The majority of cases occur in individuals over 60. Smoking is another major risk factor and is believed to contribute to a significant percentage of cases. Chronic pancreatitis, long-term inflammation of the pancreas, can also increase risk over time. Obesity, family history of pancreatic cancer, and certain genetic conditions may also play a role. Because pancreatic cancer can develop silently, early detection often depends on recognizing symptoms and seeking medical evaluation quickly. Doctors may use several diagnostic tools including blood tests, imaging scans such as CT scans or MRIs, and specialized ultrasound procedures that allow them to view the pancreas more clearly. In some cases, a biopsy may be needed to confirm the diagnosis. The encouraging news is that awareness is growing. When pancreatic cancer is detected earlier, treatment options expand significantly. These may include surgery, chemotherapy, radiation therapy, or a combination of approaches. Advances in medical research are also improving survival rates by developing more targeted treatments and better screening methods for high-risk individuals. For seniors and their families, the most important takeaway is this: do not ignore persistent changes in your body. Pain that doesn't go away, unexplained weight loss, digestive changes, or sudden diabetes may seem unrelated at first, but together they can form a pattern that deserves medical attention. The body often whispers before it screams, and learning to listen to those whispers can make a tremendous difference. Maintaining regular medical checkups becomes increasingly important as we age. Discussing new symptoms with a doctor, even if they seem minor, can lead to earlier detection of many serious conditions. Paying attention to diet, staying physically active, avoiding smoking, and managing weight can also support overall pancreatic health and reduce certain risk factors. Pancreatic cancer may be silent, but it is not completely invisible. The body does send signals: abdominal pain that spreads to the back, unexplained weight loss, appetite changes, digestive problems, jaundice, sudden diabetes, persistent fatigue, and ongoing nausea are all symptoms that should never be ignored, especially after the age of 60. Recognizing these warning signs early could help someone seek medical care sooner and potentially catch the disease at a stage where treatment is more effective. The most important message to remember today is simple. Your body knows when something isn't right. If you notice persistent or unusual changes, trust your instincts and speak with a healthcare professional. Early attention can make a life-saving difference. If you found this information helpful, take a moment to share this video with someone you care about, because it could help them recognize an important warning sign. And don't forget to subscribe to the channel, like this video, and let me know in the comments what health topic you would like to learn about next. Your support helps us continue bringing important health information that can truly make a difference in people's lives.